Neurology Quiz number 115. Describe the pathogenesis, clinical features, and investigation of limbic-predominant age-related TDP43 encephalopathy or late. Limbic-predominant age-related TDP43 encephalopathy or late is characterized by amnestic dementia resembling Alzheimer's disease. It is most common in adults over 80 years of age. Neuropathological findings in late, which are labeled as late neuropathological change or late NC, consists of neuronal and glial cytoplasmic TDP43, localized predominantly in the limbic areas with or without coexisting hippocampal sclerosis. TDP43 is a protein that normally helps to regulate gene expression in the brain and other tissues. Misfolded TDP43 has a causative role in ALS and frontotemporal dementia and has also been identified in Alzheimer's disease and with aging. There may be coexistent Alzheimer's disease neuropathology in late but without FTD or ALS pathology. This figure shows neuronal intranuclear TDP43 inclusions with a cat's eye shape, which are present in the entorhinal cortex on the left, and glial cytoplasmic inclusions are seen in the temporal white matter on the right, and this is from a patient with frontotemporal dementia. The stain used is phosphorylated TDP43 specific antibody. Late is most common with advanced age, particularly in individuals in their 80s and 90s. Studies have shown that late NC is very common in aging, affecting approximately a third of individuals more than 85 years of age and is uncommon in those less than 75 years old. Late is a slowly progressive amnestic clinical syndrome. The most salient cognitive feature of late is progressive episodic memory loss, and this is a type of long-term memory that involves conscious recollection of previous experiences together with their context in terms of time, place, associated emotions, etc. This type of memory loss is characterized by relatively preserved immediate memory or encoding, but the presence of a significant deficit in delayed recall that is generally not substantially improved with cueing. Patients may also have mild semantic memory deficits. This is detected as a mild relative decrement in performance on measures of category fluency, such as generating names of animals. Other cognitive domains are largely spared until later in the course of late, in course to typical Alzheimer's disease, which is generally an amnestic multi-domain syndrome. Another feature of late is a relatively indolent course, with the amnestic syndrome often predominating for several years. 2 or more years of such a presentation is common and supports the diagnosis. The longer the course without the development of significant additional cortical cognitive features, the higher the likelihood of late NC rather than Alzheimer's disease. Patients can be misdiagnosed as AD or mild cognitive impairment. Patients with late typically have brain imaging that reveals prominent unilateral or bilateral hippocampal atrophy, which is often out of proportion for a given level of memory impairment or disease severity. Negative amyloid and tau imaging, negative dopamine transporter scan, and normal levels of amyloid and phosphorylated tau in the CSF. These MRI scans show severe atrophy of the head and body of the hippocampus in a 90-year-old man with late. These coronal MRI scans demonstrate severe hippocampal atrophy and severe cortical thinning in the entorhinal cortex, with whitening of the collateral sulcus in an 86-year-old man with late. This figure on the left shows an FDG PET pattern of hypometabolism in late, with arrows pointing to severe hypometabolism of the medial temporal lobe and relative sparing of the inferolateral temporal cortex. On the right, is shown the FDG PET pattern in typical AD with milder medial temporal hypometabolism and more significant hypometabolism in the inferolateral temporal cortex. Autopsy data suggests that a significant proportion, up to 20% of patients with clinically diagnosed Alzheimer's disease were misdiagnosed based on neurological examination and neuroimaging, and patients' cognitive decline was more likely due to late NC. With the availability of anti-amyloid medications, distinguishing of late NC from AD is critical and will lead to greater clinical recognition of amnestic patients without Alzheimer's disease.